Hey, YouTube, we're back.
Hi, we're back.
Anxiety, we're here. We're here for it because it is here. Anxiety is like, it's everywhere.
It's everywhere.
Everybody's anxious. Do you see it everywhere? Everywhere you go, you're in Walmart.
I see it.
You're like, whoa.
There's anxiety.
Slow down.
It's right there.
It's everywhere. Me and Steph called it the monkey.
Hands all, yeah, it's just.
Yeah, everybody's anxious these days. It's so common. So if you're suffering with anxiety, just know that it's very common, and there is treatment for it. Okay, so you don't have to suffer with anxiety. There is actually treatment, and we got some more tips like we had for the depression. We have tips for the anxiety. So you want to start off with defining it?
Sure.
Perfect. I know you guys know what anxiety and panic is. We're going to kind of do both, anxiety and panic attacks. We figured you might as well do both of them together.
Some anxiety is good for you.
Thank you.
Other anxiety is not so good for you. So we're going to talk about the not so good for you anxiety. So anxiety, some symptoms of it would be feeling on edge.
Yes. Difficulty concentrating.
Oh, yes. Irritability. Everybody get on your nerve for no reason. Worry, excessive worry about everything. My nail appointment tomorrow, oh Lord.
Yeah,
worry about nail tech on me, just stuff that don't matter. So excessive worry about every little thing. Just I gotta worry. You worry about the grocery store. I'm worried about going to the grocery store. I'm worried about my nail polish came off. I mean, just anything. Just worry about the carpet. You know, people worry about everything.
They worry about the kids a lot, and nothing is wrong. Usually there's nothing wrong. You're worrying about things that there is no real fear there.
It's excessive is when it's a problem.
Absolutely.
Keyword, excessive.
And usually there's also an issue with sleep, which is also common with the depression. Depression and anxiety, they're best friends. They usually roll together, kind of like me and you.
Yeah.
They kind of roll together. So sleep is usually difficult, because of the worry. And so it keeps you up, and typically you will have the racing thoughts at bedtime. Oh, them racing thoughts.
My brain is full to bursting. If I have to memorize a single order, I think I'm gonna explode.
I know y'all know about them racing thoughts.
I know you know about shut off. Just thinking. Yeah, and then you tend to overthink things and make a bad decision.
And then what happens is the sleep gets off, and when the sleep gets off, that contributes to the anxiety because you're not sleeping, and the depression. So you get in this vicious cycle. And so that is pretty much the keys to diagnosing anxiety. And then of course you guys know panic disorder is when you're having the panic attacks, which is the racing heart. You get the pounding heart, the feeling of doom, the feeling that you got to leave the room. What else? The panic disorder, sweating. Yeah. High anxiety. Just what else? To panic disorder, doom, sweating, racing heart.
Feel like you're having a heart attack, like you might die, like feeling that you're gonna die.
Shortness of breath.
Yeah,
it's kind of got cardiac feeling. A lot of people go to the hospital thinking they're having a heart attack, and it's a panic attack.
Yes.
I know you guys out there know what I'm talking about. Somebody out there like, I just went to the ER.
Have you ever had a panic attack?
Girl, I've had 3 panic attacks in my life. 3. Have you?
No, I haven't.
I've had 3. And I vowed that anybody come see me, I'm gonna have no panic attacks, okay? Because they are no joke. Steffi, they are no joke.
I was with you, I think, with 2.
Oh my God. Oh Lord.
Panic.
Can I give them just a short story?
Just give me a little bit.
Okay. So, short story. One time, I thought I lost my son in the house. He was a baby. I was on the phone with Steph. He was a little baby. I couldn't find him. He was asleep under his crib. Don't judge me, okay? He was asleep. He wasn't asleep. He got up on, I don't know how he got it. I don't know.
You know, little babies sleep all on the floor. It's little babies.
I was hysterical. I couldn't find him for about a minute.
She was out of her everlasting mind.
Panic attack. Okay.
Panic attack.
Number 2, I was at a place called Neomed, where we had to go as nurse practitioner students, and we would have to perform exams. And we had to do a rectal exam on a male physician. The patient was a physician. And you had to watch as other students went before you. And as I watched the other students do the rectal exam, I had a panic attack. I was like, and I didn't know what was going on. I started feeling sweaty, clammy, heart racing, shortness of breath, felt like I was going to leave. Yeah, faint. I needed to get out the room. Steph looked at me, she's like, "You okay?" I had to leave. So they escorted me out. I was able to sit on the couch and I was able to calm down. At that time, I did not know what it was. I didn't know what was going on, guys. I was like, oh my God. And I remember leaving Steph like, what happened? I'm like, I don't know what that was. I just freaked out. You know, that I just didn't want to do that particular procedure. Ended up going back in, did the procedure, passed and everything, but I didn't know what it was. Then lastly was, I was taking my boards to be a nurse practitioner, and when you get ready to take your boards, right when you get ready to click submit, submit the test, you have to wait about 15 seconds for you to get your results. And in that 15 seconds, I had a panic attack. Now then I knew what it was. And again, I was crying. I started crying, shaking, heart rate. I mean, it was just horrible. I started crying. I mean, it was just absolutely terrible. And I vowed that when my patients came in to see me, that I would work really hard to make sure that they didn't have panic attacks, because I was like, this is horrible. So that leads us into this video. And so we're going to give you some tips like we did for depression. We're going to give you some tips so you don't have panic attacks, okay?
And decrease your anxiety.
Number one.
Drum roll, please. Avoid situations. Number one, exercise. Try exercising.
Exercise is a great way.
Get on treadmill.
It helps with anxiety, guys.
Yes.
Exercise. I know y'all like exercise again, really.
Again.
Those out there that exercise, they know it helps with that anxiety. It lowers that anxiety.
Or, you know, exercise could be you working in the garden.
Correct.
Rake.
Yes.
Plant some flowers. Do something to work off that energy, because it's like an excessive amount of energy that you have all bumbled up inside, and you need to get it out.
Correct.
So exercising and yard work and vacuuming and mopping and cleaning, all that gets rid of that, and then you feel better.
It's a great way to kind of manage it. Especially if it's more mild to moderate. Now, keep in mind, depending on the severity of your anxiety, exercise is going to help, but it may not get rid of it. Okay, so keep in mind, it depends on the severity. With mental illness, there is severity to it. Some people have it mild, some people have it moderate, some people have it severe. Okay, keep that in mind. Number two, relaxation. You got to relax. My personal favorite. Love it. Find a way to relax. What do you do to relax every day? I try to find something to do to relax. It could be sitting and listening to music. What do you do?
I like to float in the swimming pool.
That is very
upside
relaxing.
down and look at the sky, the pretty blue sky.
Yeah. Swimming, listening to music, reading.
Cooking. I know that sounds crazy, but I love to cook.
Yeah, cooks, bake. People that bake, they like to do that too.
Oh my God, it just relaxes you. You're like, oh, who's that? So you're creating things. So that is a very good.
Whatever you like to do, it may be bubble bath. You know, it may be watching YouTube videos if that's what relaxes you.
Take the dog for a walk.
Yeah, and then that way, being with your dog, you know, petting your dog, being with your cat, your bird, you know, your animal. I mean, whatever relaxes you, whatever. Yeah, I know, right? But you have to find what relaxes you. And then
Yes.
the key is be intentional with that behavior and do it every day. If
Yes.
you're intentional with that behavior and you do it, it's going to relax you. It's going to lower your anxiety.
True.
Number 3.
That would be deep breathing.
Oh, yes. Have y'all tried deep breathing? I know they like, of course we try deep breathing. I mean, seriously, like you got to try deep breathing. If you get anxious, the next time you get anxious, just deep breathe.
Yes.
Let's show them. You ready?
Go.
I like deep breathing. When I get anxious about
It's
something,
wonderful.
I'll just deep breathe and it immediately kind of brings me down. It helps me to focus. I mean, it works, guys. Just slow down, deep breathe, okay? And you will find yourself, bringing your anxiety down a little bit. Now, I mean, it ain't the cure, but it does lower it a little bit so that way you can get where you need to get to safely. Okay?
Absolutely.
Number 4. This is my favorite.
My favorite one.
I love this one. Stop taking everybody so seriously. I just stopped taking people so seriously. I just don't take them seriously no more.
Not at all.
You can't take everybody so seriously. It's like, well, this person said this about me, or this person said that.
Okay. They
Okay.
talked about Jesus. Let it go.
Let it go. Just let it go. You can't take people so seriously because those thoughts will race in your mind and they jack up your anxiety, people.
You can't please everybody.
You can't. No.
So don't even try.
Ma'am. I do the best I can. And it's not, everybody's not going to love it, people.
Nope. No, they're not.
Okay.
Uh-huh.
Number 5.
Mindfulness.
I love mindfulness. Mindfulness, stay present. So like right now, I am here with the YouTube family. I'm not nowhere else. You know how you could be somewhere
Hey,
else,
YouTube.
and then you be somewhere else? You be at the grocery store. Girl, you be down the street, round the corner. People be thinking you somewhere, you ain't there. They be like, girl, where you at? Because your mind be done raced
Went over somewhere else.
somewhere else.
Like,
Focus on staying right here.
be mindful.
I'm gonna
stay, live in the moment.
In the moment,
present,
right here.
right now.
Right now. I'm so happy I'm right here, right now, right here.
Ooh, me too.
Oh, I'm so happy.
Yes.
I'm right here. I ain't in no hospital.
No.
I ain't in no funeral home.
No.
I ain't in emergency surgery.
No.
I ain't got no phone call said that Ray done went to the hospital.
Nope.
I'm so happy right here behind this camera.
Woo.
Lord,
Yes.
in the name of Jesus. I'm just saying.
Absolutely.
I'm just happy about that. You got to stay present. You got to stay
Yes.
right here.
This is number 6 is her favorite.
Oh, psychotherapy, yes. You gotta get to some counseling and some psychotherapy because it really changes the way you think. And a lot of times the anxiety is just about how you think. You gotta change your thoughts.
Absolutely.
You gotta change those racing
Negative thinking.
Yeah.
Get some positive things going on.
Yes, you gotta change that
Negativity
negative
out.
thought
Yeah,
to a
just
positive thought.
A lot of people who have a lot of anxiety, everything is the end. It's just so bad. Oh my gosh, it's so bad. It's not.
It's not.
It is not that
It is
bad.
not. So psychotherapy really helps you with that. That counseling really helps. So it helps with the depression and also with the anxiety. So trying to reach out and finding a counselor is a great strategy to dealing with anxiety and panic disorder. It's a great strategy.
Great. Absolutely great. How about every thought, this is number 7, it's not a valid thought.
Preach.
Oh,
Everybody thinks because they thought it because it makes it valid.
it is not.
No. I'll have a thought and I'm like, oh, that ain't valid. Just because you thought it don't mean it's valid. You got to challenge your
It's kind of
thoughts.
stupid, actually.
Yeah, you be like,
oh my God.
No. I'll tell some of the stuff. She'll be like, no, that ain't right. I'll be like, that ain't right, is it? She'll be like, I'll be like, oh, okay. You right. That ain't right. Why am I thinking like that? She'll be like, Tiff, why are you nervous about that? I'll be like, I don't know. She'll be like, Tiff, stop.
Knock it off.
Knock it off. That's what she tell me. She'll be like, Tiff, knock it off. And I'll be
Knock
like,
it off.
Okay. All
She'll
right.
be like, okay.
Okay, I'll knock it off there. Sometimes that's all you need to bring that anxiety right on down. Sometimes it ain't rocket science, people.
It's
It's not rocket science,
It
okay?
is not.
These racing thoughts that you be having at night, they become automatic thoughts. And those automatic thoughts will increase your anxiety. And so that's why the psychotherapy is so important, because you have to stop your automatic thoughts, those thoughts that just keep entering into your mind. Those are actually called intrusive thoughts. And you have to stop those. And that's why the psychotherapy is important, because you have to stop those intrusive automatic thoughts that most of the time are invalid.
Yeah. And therapy helps you retrain your brain so you don't stay in that whole rut.
Yes.
We're gonna call it a rut.
We're going to call it a rut. I like that. That's a good word. I like rut. Number 9.
Number 9 is positive thinking. Stay positive.
The cup is half full.
Oh my God.
It's half full.
Not half empty.
It's half full.
It's half full.
It's half full.
If you just start looking at things like that, you'll start feeling better.
You will. And anxiety will come down.
Right now.
You have power over your thoughts.
You do.
You have power over your thoughts. You have power over your thoughts.
You are in charge.
Yes, you are. Okay. And number 10.
Oh yeah.
I like this one. Because people, they get this one.
This is a good one.
This is a good one right here. All you weed smokers out there. Marijuana can increase your anxiety.
Okay.
Uh-oh. Drop the mic on that one.
Woo!
I know y'all out
Drop
there.
the mic.
I know y'all out there like, not for me, girl. Okay, I ain't talking to everybody. But there's some people out there, they smoke weed, right? They smoke their marijuana, right? And then they get real anxious.
Ooh, real anxious.
And they come to me, they be like, that marijuana make me anxious. It does. And some people, it increases anxiety, guys, okay? So I just want you to keep that in mind. If I ain't talking to you, then I ain't talking to you. Okay? But if you are one of them people that did smoke some marijuana and you like, ooh,
This don't feel too good.
I'm anxious.
Ooh, little monkey.
That monkey be like,
Eat all on your back, tapping you, hitting you all across the face. You're like, oh, Lord.
don't do that.
No.
Don't do that.
Don't do it.
marijuana.
Just don't do the
Just
marijuana.
don't do the marijuana.
Stay away from the marijuana.
Yeah, that would be my advice. It doesn't work the same for everybody's body chemistry.
It does not.
Caller, any questions you got? I love it. I love the call piece.
Oh,
That is so
that
nice.
was a good one, wasn't it? Yeah.
That was great. It is so fun talking to y'all. Thank
Yes,
you for
it
listening.
is.
Thank you for tuning in.
It
We
is.
really appreciate it. We hope this
And
is
remember,
helping you
if
guys.
anyone is experiencing or having any suicide thoughts at all, please
Yes.
call the suicide hotline.
Please.
You can find that number on our page.
Yes, get some help.
Please.
Please.
Yes.
Thank you so
Thank
much
you.
for coming.
Goodbye.
Bye, you
Bye.
too.